makes the blood pump back up into the leg when they step on it right there. It's hard to wake up and be happy when you hurt every day. I was getting to the point where I was having a lot of back pain. One morning when I went to come out of the shower, my leg wouldn't work and I fell out of the shower onto the floor.
And he flopped around the floor for 6 hours before he finally let me take him in. We went to the local orthopedic place that does back surgery, and it was a very negative experience. At that point, that's when I'm like, okay, we're out of here.
I knew at that point that something pretty significant was going on. My back was in really bad shape. Growing up, part of being a man is you took care of everybody and you just shut up, and it didn't matter if it hurt. You went to work and you did it anyway. And it was getting to the point where I didn't know if I could do it anymore. It was a really emasculating, horrible feeling. You're scared, am I gonna get better? Am I ever gonna be able to work to support my family or recreation, you know? My passion's horses, I train my own horses. At that point, didn't know what to do. I was kind of, you know, am I gonna be done?
It was the most overwhelming feeling. It's very hopeless. You can't fix it. And so you can only, you know, offer that support, and then that's when it's like, okay, what I can do is find him the best surgeon there is.
Let's go somewhere where they have the best. So that's when we started the process of trying to find Dr. Baig in his office. And the first consult was actually, he was off work at home with his family when he called us from his home.
Being a doctor, you're allowed to change people's lives more fundamentally than any other profession out there. Craig's pathology was straightforward in my mind because this is all I do all the time, but it was very complex and convoluted to them from the experiences that they had gone through. It started off with a phone conversation with Craig, you know, going down the pathology bit by bit and how his vertebrae had shifted, how his nerves were severely compressed. There was no doubt in my mind that Craig's pathology was the source of his pain. If you're doing this on a day-to-day basis, this is, you know, what you do. The challenge for a surgeon is not the surgery itself. The challenge is to alleviate the patient's fear and say, hey, we got this. You can see their fears come down one notch after another notch after another notch before they go ahead and say, hey, you know, walk that journey with us.
It was an answer to our prayers. It really was an answer to our prayers, the fact that we found him. Because we had been praying to go, where do we go? You know, he spent that time with us. He went through the x-rays, the CAT scans, the MRIs. You know, this is what we need to do to fix it. And so it was one of those things that was like, okay, let's do it.
That's when I really started trusting him, and I knew this was the guy that I wanted working on me. I got out of surgery, hour after I woke up. I was up and walking. Started physical therapy the following morning. I was getting around pretty good. 4 days out, I believe, walked on the airplane. My wife tried to get me to ride a wheelchair on. I said that is not happening. And 5 weeks out, I actually went, helped some friends, Brian cattle. I was on a horse roping. Oh, it felt great. I mean, I was still hurting a little, but it felt great. So we did a small pleasure ride, probably a half mile. I could have went farther, but my wife wouldn't let me.
As a surgeon, the finished product is always getting a patient back to where he used to be, enjoying his life, transforming his life, and being part of that journey.
To me, his honesty and integrity made me believe in him. I could believe in his knowledge. He's like the Michael Jordan of back surgery. There's always going to be a connection. You know, there's that appreciation.
I love waking up in the morning and being able to be at this scrub sink, washing my hands. We all impact each other's lives one way or the other. But I think in a fundamental sense, you're there to rise to the challenge of answering to people's prayers. Seeing Craig get back on his horse just reinforces and validates why I get up every morning to do what I do.
for a long time, I got used to that pain, and that's what you do. And people who have back pain understand that. You get used to it, and you deal with it, and you pop the whatever gives you relief. And then it just gets to a point where it really gets difficult. And you know that point's coming in your life, you just don't know when. When I was looking for a surgeon to do this, I was looking for that person that I was going to connect with and I felt comfortable with, and I wasn't going to be afraid what it was going to be like when I woke up. And that's Dr. Baig. That's absolutely Dr. Baig. We kind of knew the problems. I wanted to know the solutions and that it was going to be good again. I'm picky. If you're going to cut me open, I want a good surgeon. I want somebody who is going to be there for me. I want somebody who is going to convince me that everything's going to be okay. I was one of those people who said, I'm not doing that. I am not doing back surgery. I won't even consider it. And I said that for years and years and years. All my life, I said that. I won't do it. But you can only go so long with the extreme kind of pain that you deal with when you have back pain. And when it gets to the point where it's that bad and you really can't enjoy anything in life anymore, then you do have to come to the realization of getting it done. And then it becomes the part where you just have to say, okay, I need to find the right person for the job. If there was somebody who contacted me and said, okay, I live in New York City, and I can't get there, but do you know anybody out here that's like Dr. Baig? I'd say, fly. Because in my opinion, no. I've dealt with this for a long time. And no, I think he's the guy. I just can't even praise him enough for how he has changed my life. Absolutely changed my life. My life today, it hasn't been this good, I want to say, probably since I was in high school. I'm just eternally grateful that I'm healthy and happy and moving and pain-free, and life has never been better. Never been better.
Our office is Pat's little art gallery. Every time she has followed up with us, she has dropped off a piece of art that we have throughout the office that you wouldn't recognize what was made by Pat. Pat came to us after years of struggling with back pain and had visited multiple other people and done her research. I think it's important, aside from being a good technician in the operating room, is to how to help someone understand that what we do here is to also address your fears of undergoing spinal surgery. There was no way around not doing spinal surgery on Pat because of how unstable her spine was. It was a good long conversation, and finally I had to just look her in the eye and say, I've got this, Pat. Being transparent with Pat about the challenges in the operating room, about my training, and my experience with similar situations gave her the confidence to proceed with surgery immediately. It's great to see Pat living her best life now, back to her arts and crafts, even teaching classes now, from what I understand, pain-free.
My neighbor and I were talking, and we had a landscaper come in and trim our palm trees. We do it together, so we get a good deal. And Terry said to me, "So you having back surgery?" I said, "Yeah." "When is it? Next week?" I said, "I had it last week." He went, "Are you kidding me?" Dr. Baig he's a miracle worker. Okay, he's not a surgeon, he's a miracle worker. When I came to this office today, I actually walked up the flight of stairs. I didn't take the elevator. I take stairs now without pain. Thank you, Dr. Baig. My name is Paul Hand. I had surgery with Dr. Baig for my L3, 4, 5, and S1. I think 74 years is the new 50 for me after the surgery. I did dumb things when I was younger. I injured my back when I was 21. I've always had back problems. I've had multiple injections of steroids from pain management. I've had a rhizotomy. I've had RFAs, which are radio frequency ablations. And then even my pain management doctor said to me, "I think it's time for you to have surgery." And that's a big statement from him. I would do everything I could not to have surgery. It's a scary situation when your surgery is on your spine. You think crazy thoughts. I've heard good stories about surgery. I've heard bad stories about surgery. I've heard people that have had multiple surgeries on their back and still no relief. That's what frightened me. Dr. Baig is not the only doctor I talk to. There's two types of surgery. There's the Dr. Baig surgery, endoscopic, minimally invasive, recuperation time 2 to 3 days with Tylenol and ibuprofen. No narcotic drugs. Or I can do the traditional. I'd still be in the hospital, still on pain meds, 3 to 4, maybe 5 months of recuperation, physical therapy, bolts, screws, plates, everything in my back. No thank you. So I did my research on Dr. Baig. He's one of the few doctors that actually does this surgery. He's had great success with it. I did my homework. It's my back. It's my life. He just looked at me and said, "I can do this, but you have to have faith in me to do that." I get really emotional about that. When it was all said and done, I had to come back for my follow-up. I hugged the guy. I cried. He said to me, "Thank you for putting faith in me." Okay. I said, "No, thank you for giving me a new life." That's a big trade-off. He's a man with a soul. Can't put a dollar sign on your health. I've heard that. It's so true. It is very true. I'm so happy I did it. I'm here. I'm sitting up straight, not sitting like this, but that's me.
Paul, like a lot of my patients, was looking to get his life back. Paul had a previous opinion before me. I always like to educate all my patients during their first visit, not try to go ahead and convince them of one way or the other, but to educate them as to what needs to be done in order to get him back to good. And through the years of trying just about everything under the sun to alleviate his symptoms, he was well versed in the types of surgeries that were available. The previous opinion recommended a decompression infusion. When we sat down, he wanted an alternative. He did not want a lengthy surgery. He did not care for the blood transfusions, the hospital stay, big surgeries that are often associated with higher chance of infection and so on and so forth. So we discussed an endoscopic decompression. Paul had multi-level spinal stenosis. And when we talked about an endoscopic decompression, he thought it was too good to be true. He actually had a third opinion lined up after me. And after meeting with me, he went home with his wife. They talked about it. And we got a call from him and his wife saying that we want to proceed and that he's canceling his third opinion. Because the gentleman, a very reputable spine surgeon, a fellow colleague of mine, only does a decompression infusion. And so off to the races we were in terms of getting him worked up for surgery, lab work, EKG, all the fun stuff. The day of surgery, again, very, very, very high level of anxiety. Whether this is going to work or not, too good to be true or not, How much pain is there going to be involved? How much pain pills is going to be? Is this truly an outpatient surgery? I called him at home the evening of his surgery, and he could not believe the fact that he has yet to take a pain pill. I called him the next day. He was already out and walking several thousand steps, and he goes, "Is this just the anesthesia?" And I reinforced the fact that this is common amongst all my endoscopic patients, where they almost feel like it's too good to be true. 2 weeks later, same thing, and then when he came back to the office, I remember him trying to pull a joke on me. He tried to pretend that he couldn't get out of a chair, and then got up perfectly smiling just to go ahead and pull one on me. Walked with a perfect posture and just gave me a big hug. Paul was in tears, and again, this is so gratifying to see people back to their good within a couple of hours of having a surgery with minimal amount of downtime.
My name is Sean Collins.
My name's Addison Lofsted, and I'm a physician assistant at Desert Spine and Scoliosis Center.
We are getting married this week, actually. About a year and a half ago, I was at the gym squatting a little too heavy, and I kinked my back. And it was such a painful scenario where I wasn't able to walk. Addison came home and essentially told me to come into the doctor's office, but me being thick-skulled, I put it off for about 8 months.
I knew almost instantly when Sean came home limping. He looked like our typical patient of a herniated disc. He was having that radicular pain in his leg, and he was just absolutely miserable.
So those 8 months were excruciating, and sleeping was the worst part of it. I had to stay perfectly still on my side, or I wasn't able to sleep. I was getting between, I would say, an hour to 4 hours of sleep a night.
And I see this kind of thing all the time. Living it and seeing somebody that you love so dearly having to go through this kind of pain was horrible. I wouldn't wish it on anybody in the whole world. Thankfully, I work for Dr. Baig, and he made us feel like family. Sean had a huge herniation at L4-5. He was having really bad radicular symptoms into the left leg. So essentially, once we saw that imaging, we knew right away it was surgical. We had tried to give him like a steroid pack to kind of calm down his symptoms or calm down that nerve pain. Eventually, we all kind of knew that it was big enough that at some point it would require some surgical intervention. So as soon as Sean was ready to go, we had him sign up for a laminectomy microdiscectomy at L4-5. Essentially went in and removed that herniation and relieved that nerve pain. And the reason we went with Dr. Baig is, I see firsthand every single day what he does in the operating room. I see how talented he is. I see how well patients do afterwards, so I wouldn't trust anybody else in the world.
He treated me like a gem. He treated me like family immediately, sent me to get the MRI, and like I said, as soon as I could get into surgery, we booked the surgery and everything went amazing. When I did come out of surgery, I noticed instantaneously relief. I came home, I was able to lay down on my bed for the first time in a month and a half and go to sleep for, I think it was 14 hours right after that. So that was the best moment of my life.
Ever. We do have insurance. We could have gone pretty much anywhere. There's a lot of surgeons in the Valley. I think what it was for me was, I've seen Dr. Baig every single day operate. I know how he does what he does, and I see how good the outcomes are. He's an amazing surgeon, and his patients know that. And we have patients who come back, if they need something way down the road, and they're always like, I would only trust Dr. Baig if I ever have to have another spine surgery. So I knew, I was very confident about, having Sean come in here and see him, because I see it every day. I see how much he can impact other people's lives.
My name is Tyler Ryan, and I'm 38 years old. I had an endoscopic discectomy about 6 months ago, and it was the best decision I could have made. My life was terrible. It was so hard to go to a movie, to work. I have a blue-collar job cleaning swimming pools. It was hard to do anything. I couldn't play catch with my kids, and that hurt quite a bit. I was in so much pain. I never wished this upon my worst enemy. So my mom, she worked in the medical imaging industry for decades, and she knows a lot of doctors. She basically gave me no choice. She said, I know what surgeon you need to see, and it's Dr. Baig. And after meeting Dr. Baig, I simply felt so confident. So I was presented with both options of back surgery. I almost had no choice but to choose endoscopic discectomy. I just had virtually no time. I didn't have the luxury of recovering in a hospital bed. I needed to get up that day and manage my accounts. Because I chose that, I did not skip a beat in my business, and I didn't have any downtime after my surgery. Directly after surgery, I'll never forget, Dr. Baig asked me as soon as I woke up, how's your back pain, Tyler? And I said, 0. And I was so happy to say that. It shocked me that I had no more leg or back pain. So to be here talking to you pain-free right now in this chair, I wish I could stand up and not bump the microphone, because I can stand up straight again. And every day I have to almost pinch myself because I'm in so little pain. If you think you need back surgery and are kicking the can down the road, I suggest you go see Dr. Baig. He may say you don't need surgery right now. He may say you need surgery. If you need surgery, I suggest you follow his direction and get surgery. I have so much confidence in his surgical ability to correct your issue.
Linda has known me ever since I started practice, back in 2011. She knows just about every spine surgeon here in the Valley. For Linda to tap me to take care of her son, that level of responsibility is extremely humbling. But it's also a lot of pressure because this is Linda's baby. Tyler runs his own business, runs a pool cleaning business. The pain was so miserable for him. The sciatic pain going down his legs impacted his relationship with his wife, his kids. He wanted the quickest recovery so that he can get back to providing for his family and being the husband and father that he wanted to be. And he proceeded with an endoscopic decompression and a microdiscectomy. As with all of our endoscopic patients, Tyler did not need a single pain pill and only required over-the-counter Tylenol as well as ibuprofen for the first 24 to 36 hours. Tyler's 38, and he underwent an endoscopic decompression microdiscectomy. Our oldest patient is 84, who underwent the same surgery. The results are phenomenal for both of them. Minimal downtime, back to doing everything that they want to do with a Band-Aid at the end of it all. We have a full gambit of patients across the board in between those age ranges, if not even beyond those age ranges. It's my job to go ahead and explain and educate you as to the full spectrum of treatments that are available to you. You may not be a candidate for an endoscopic procedure and may require something more invasive, or the second opinion that you come to me for may be, hey, here's an endoscopic option for you, not requiring a traditional open surgery and a protracted recovery.
Jiu-jitsu is my relief, I guess, my stress relief. It is where I go to just to basically de-stress. Just like I can come here and just put all my anger out on the mat and then go home happy. You know, I get all that muck off me from the day. I was doing a CrossFit lift and I pulled the bar up and I heard 3 pops in my back. I was like, oh, and I tried to lift the bar again and I was like, nope, not gonna happen. So I'm going to a big orthopedic center, you know, of Tucson, you know, they should have the latest and greatest, and now they're telling me, no, the best we can do for you is a fusion. I'm like, okay, no. I absolutely said, I'm too young to have a fusion. This is ridiculous. I don't want to lose my mobility. I'm too active. I do jiu-jitsu competitions. This is not what I want in my life. I was like, let me Google this. There's got to be something better. Googled, you know, orthopedic or back doctors in Arizona, and Dr. Baig's website popped up. You know, I was looking at his videos and I was like, this is exactly what I'm looking for. I was like, I knew this technology was out there. How do I get more information? And I had told my husband, like, look, I've got the Michael Jordan of back surgery here. Come on, this is slam dunk. He didn't want to go straight to surgery, which I loved, you know, because he was like, well, okay, well, we don't want to just go do a disc replacement and find out that wasn't your root cause. I was like, that's great, you know, yeah, let's go down some avenues and see if this is definitely what I need. So we went through the blocks, didn't work. I was like, okay, Dr. Baig, I don't think it's that. And he's like, okay, well, we're gonna try the discogram. This will actually pinpoint to see if the pain is actually coming from your disc. Boom, success. I was like, yep, that was it. It felt great. So go through surgery, you know, fingers crossed. Let's hope this works out. He treated me like a person. And like I said, it was huge that he was willing to go through all those other processes to make sure that this was the right thing for me. I had spine surgery and you would never know, compared to how I was living before to now, totally 180. I told Dr. Baig, if it takes just 50% of my pain away, I'd be great. It's probably 95, 98%. Seriously, I go around looking for people who have back so almost and be like, hey, I have a great doctor. You've got to go see this guy. I mean, just the way that he cared for me and yeah, just talked through things and treated me like a person, you know, asked me how I was like, and the fact that he remembers me and, you know, checks up, you know, later, oh yeah, come back and see me later. I want to hear, you know, want to make sure you're doing okay. It's just awesome. Like I said, I go around searching for people that need that have bad backs. So like, I know this guy, you've got to go see him. He's amazing.
What can I say about JoBeth? JoBeth is ingrained in my memory because of a series of challenges, but not only that, the dynamic personality that she was. I think it's important as a surgeon, at least at my practice, that we combine not only the MRI and X-rays, but also understand the person, who they are, and the lifestyle that they live, so that you can offer them an alternative to a fusion surgery. She is a Brazilian Jiu-Jitsu black belt and runs a full-time operation south of Tucson with her husband. Jiu-Jitsu is her life. Aside from being an active mother of 3 and a wife to a wonderful husband, she lives for Jiu-Jitsu. And someone who is an avid fan of mixed martial arts, I intimately know what that martial art or that combat sport and how it affects the spine and what a fusion would have done to JoBeth. So when she came to me, she had near complete loss of her disc space, and it was my job to understand whether or not her symptoms were coming from the disc or were they coming from her facet joint. That was the first challenge, like trying to figure out what's causing her pain. Once we kind of had it kind of narrowed down, the second challenge with her was going to bat for her with the insurance company. It was kind of tortuous. It was a long path getting there. But at the end of it all, we finally got it approved. When I saw her in recovery, though she was a little groggy, she understood one thing, that she got a disc replacement, and the level of just gratitude and the tears that she had coming down her eyes, despite her post-anesthesia, loopiness, she knew that she got the procedure she desired. Fast forward 6 weeks later, she couldn't be a happier person. She was so ecstatic about the surgery, the pain relief, the efforts that we put in, not only the administrative efforts, but the diagnostic effort, and of course, the surgery itself. JoBeth I think stands out in my mind because she did not settle for the status quo. Kind of reminds me of what this practice stands for as well, is that we just don't settle for just providing the same old surgery for all comers. Your treatment has to be individualized to you, matching your MRI, your X-ray, all the diagnostic tests and everything else like that. And of course, that has to go ahead and be complementary to the life that you're living and the life that you're aspiring to live.
I absolutely would never wish this pain on anybody. It was the worst pain I've ever felt. It just seemed to come out of nowhere. You would think that you would feel something, right? You would think that something, or that I was in an accident or something like that. This was nothing like that. I wasn't even doing anything. I was training somebody. I wasn't even doing the exercises. And then all of a sudden, the next morning, I just woke up like that. My name is Allison Henry. I am a trainer at Hub Fitness. And this is my story about what happened with my C5, C6. I was fine. I was here, I was training, and then the next morning I woke up with shooting pains all down my arm. It was very bizarre. And I thought maybe I slept wrong, but I was like, this is different. Like, there's something else wrong. My physical therapist gave me some referrals. One of them was Dr. Baig, and I went to 2 others. And they all came to the same conclusion. They all said, your nerve is compromised. We feel at this point like surgical intervention is the best for you. I really just bonded immediately with Dr. Baig. It wasn't just about him either. It was the people there that got me in the door. You know, they were kind. They were just very personable. I felt very welcome there. It's like he knew me from day one. He asked me, about my life and just seemed to care about me and not treat me as a number. So I just had that instant vibe with him. The fact that I wasn't scared day of surgery, I wasn't as nervous as I thought. I slept really well the night before. That was amazing to me. I just knew that he was gonna be there for me. And I wasn't worried about it. The surgery was about an hour and a half, and I got into the recovery room, and I just remember seeing Baig's face and just smiling up at him because I could tell by his demeanor that it went well. And I had all the motion and everything. I was walking that day, and the recovery, oh my gosh, the recovery, barely need any pain medication, maybe for the first 24 hours. And it just felt like for me, I had a really sore throat. The way that Baig was able to be so sensitive, I didn't want a massive scar. He even went as far as did the incision where my wrinkles are, so as I get older, the wrinkles will actually cover the line. Like, he went to that much detail to make sure that it was barely noticeable for me. He wants it to be like nothing ever happened and that you are fixed. My mom wrote him a thank you note. She just, okay, I almost started crying there. God, hold it in. She, that thank you note was just like, thank you for being amazing for my daughter. And to this day, every time I see him, he always asks about her, because it just goes to show how much of an impact he made on my life and how much I'm still able to do. I'm even stronger than I was before this. I can lift more weights. I can do what I want to do. So he changed my life, and I would 1,000%, no matter where I lived, go back to him. And no doubt about it. I literally went from having no strength in my arm, that tingling, like I'm getting stabbed right here, my thumb went numb, so I had no grip, to I'm back to doing strict pull-ups. I want to show you one. Hold on. There's no way I could have done this before. Even gonna do another one. So, yeah, he literally saved my life with that. There's no way I would have been able to do that if I didn't do that surgery.
So I remember when Allison first came to the office, young, bright girl who had done her research. Obviously, as you can tell, very much into fitness. That is her life. Very apprehensive because she was at a surgeon's office and unsure whether or not I was going to recommend spinal surgery for her. As I tell every patient, the first visit with us is all about educating them about their spinal condition. We even have them sit right next to us to review frame by frame the MRI and the options that are available to her. And again, for someone who's a personal trainer and when fitness is your lifestyle and that is your billboard, your walking billboard, when weakness starts settling in, it could be very, very, pun intended, nerve-wracking, right? So, very well-informed young lady who really wanted all the options and did a fair bit of her homework with regards to fusion versus disc replacement, and not even entertained the idea of a fusion with her as a young lady who had an active lifestyle. If we can take away the pain and maintain the motion, this would be perfect for someone like her. Allison had her husband as well as her mom present during the preoperative consultation. As I always welcome family members to be part of it. The more people that can hear, the more times that they can remember everything we talked about. Fast forward, surgery went great. A complete relief almost immediately in the recovery room, right? I mean, she was, her arm felt better. She even felt subjectively she was stronger. That weakness that she had prior to surgery had almost nearly completely resolved. A few weeks later, we received a card from her mom as to, the kind words that she shared with us about, the entire experience at the practice was heartwarming, to say the least. I think I have to say I try to keep that stoic posture in the office as well as being the captain of the ship. It was one of those, heartwarming letters that even evoked a fair bit of emotion within me. It's just like, wow, this is why we get up and do what we do, right? This is why we sacrificed the years and years of time, perfecting the craft that we do as spinal surgeons. That letter just reinforced why I get up in the morning.
I was to a point that I was in so much pain all the time that I was short-fused. I was angry. I was just upset all the time. And of course, that bled into your relationships, right? It bled into not being patient with the kids. It bled into work. And it was definitely just bleeding in a very negative way in everything else that's my life, right? I was done. I had gone through pain management for probably a year and a half, I want to say, between the epidurals and ablations. But then after that, it just didn't work. I just didn't have the relief. That's where I was doing the pain management said that, yeah, I think you should see a spine surgeon. And they referred me to Dr. Baig. It was scary, right, going to a spine surgeon, of course. But I mean, we came here, we met with Dr. Baig. He was so easy to talk to. He explained everything. We understood. We went through the MRI. He showed me, what was going on. He answered all our questions. I knew that fusing, right, would limit a lot my lifestyle, right? I was not going
down that path, right? I wanted to keep being active, even more active than I was before. He said, well, we have the fusion and we have the endoscopic spinal decompression, which is very simple, just endoscopically, just going in there and just cleaning up that bone, creating more space for those nerves to just be where they have to be, right? But when you think about your quality of life and when you think about your future, I knew that fusing, right, doing the fusion was gonna cause, first it was gonna limit my mobility, probably 60% or more, right? Which was not in the cards. That was not what I wanted. I wanted, my kids to see me happy and to see me active like I was before, and be able to keep up with them, right? They're all teenagers, and I didn't want for them to see me like a crippled mom, right? Oh, mom has this in her bag and she can't do this and this and that. I didn't want that. I decided that the endoscopic was the way to go. Outpatient, of course. I woke up, went home, and the kids were home, so I cooked dinner just like a normal. I think we went to the gym. I can't remember. Probably I did like the bike or walked on the treadmill, something like that. The same day. No pain meds. Absolutely nothing. No Oxy, no Tylenol, nor nothing. There was absolutely no pain. I think I didn't sleep the night before, probably 2 nights before that. I was so worried, but Dr. Baig just gave me the confidence that this was gonna make my life going forward what I wanted, and that's exactly what he delivered. It's even better than I ever thought, 100%.
Vanessa is an engineer, works for a Fortune 500 company right here in the Valley. As engineers, they're very technical when it comes to what we're going to be doing to their body. Vanessa's a very active person. Though she's not a professional athlete, she maintains a very, very active lifestyle. Line dances, works out avidly at the gym. There isn't anything that this person doesn't do. Vanessa would never agree to a procedure that would involve fusing her spine or limit her motion. Vanessa was discharged early afternoon from the hospital, and by 5 o'clock, I believe I gave her a phone call at home, as I do with all my patients, the day of surgery. I asked her how she was doing. Her comment to me was, "I'm back to work on a Zoom meeting. You called me at the perfect time because I just ended my Zoom meeting." Again, exemplifies how much this person loves life and being active rather than being down. She would have likely even lived with the pain rather than to acquiesce to a fusion surgery. So when she asked for options with regards to her spine, she wanted the most minimally invasive option available. To hear her say again in recovery that her pain traveling down her leg is completely gone was absolutely 100% gratifying. This is why you go to med school. This is why you wake up in the morning. This is why you go out and travel the world and learn from the leaders in endoscopic surgery on how to acquire that skill set so you can offer it to the people locally, such as Vanessa, and getting them back to good. So good that they never use a single pill of their prescription pain medication.
I had no choice because I was going downhill so rapidly. Maybe there are other people who would say, well, I'll take a wheelchair or a walker and I'll manage because I don't want to be cut. I don't want to have the knife. I never felt that way. My inability to walk very far or stand really happened over maybe 3 or 4 months. All of a sudden, things started coming apart. My name is Bill Gannett, and I'm 83 years old. One of my good friends had neck surgery from Dr. Baig, and he recommended him. We interviewed with 3 different surgeons for the back problem, and there was 2 orthopedic surgeons and 1 neurosurgeon. And it was clear to me that the presentation and information from Dr. Baig was superior. Dr. Baig's bedside manner, his delivery of the information, and his PAs also, it's just superior to what we felt with the other people. He had given me complete information as to what he was going to do, and I had confidence that he was going to accomplish it. Before my surgery, we didn't have a handicap placard, so we would park as best we could at Costco, and I would have to have a cart to walk into Costco. I couldn't just get out of the car and walk in. After the surgery, I was running within approximately 6 weeks, and now I'm able to run 4 days a week, 10K or 6.3 miles 2 days, and 5.5 miles 2 days. It all worked out the way he said it would. I can't imagine why people would suffer through those kinds of things and not do something about it. I waited 3 months before it hit that point where I had to do something, but people wait years before they do something. No reason for it. Not when Dr. Baig is available. And if he says he can fix it, he will.
Bill is probably the most active 84, 85-year-old that I've ever come across. This is a guy who's challenged me to a push-up competition, which I have yet to take him up on. This is a guy who runs several miles a day. This is someone who is still living the best life that he can live in his 80s and makes no excuses for it. I was Bill's second opinion, where we talked about surgical intervention. This is a gentleman who had multi-level severe stenosis of his lumbar spine, resulting in significant amount of impedance in his activities of daily living. Not only could he not run, he couldn't walk for prolonged periods of time, a condition called claudication or neurogenic claudication. We took care of Bill a few years ago, and Bill is back to doing almost everything he wants to do, if not even more. I think he told me he did 80 push-ups prior to surgery. Now he's up to 100 to 120 push-ups now, and I'm still hesitant to take him up on the push-up competition just because out of personal embarrassment. Not only was it a pleasure to take care of Bill, but he trusted me with his favorite loved one. We got to take care of his wonderful wife, Deanna, who had nearly the same matching surgery that Bill did, who had multi-level severe stenosis and underwent a very similar surgery that Bill did, and no longer requires the same level of medication associated with her preoperative symptoms that she had.
I'm Derek Furno. I'm a back surgery patient for Dr. Baig.
And I am Sarah Furno, and I've worked for Dr. Baig for the past 4 years. Me and my husband have been married for going on 10 years now. So my husband had come home from work and was complaining about some back pain. Kind of pushing it off, you know, it'll be better the next day. Took some ibuprofen, and then the next day it was worse.
I lifted something that probably should have took 2 people, which I've done in the past. It obviously bit me, and it took me down. So I knew for sure there was an issue, there was a problem. I've always had some back pain here and there, you know, just as physical as I get on certain things. But this time I felt something isn't right.
So working for Dr. Baig the past 4 years, and then seeing my husband with what he was suffering with. You know, he had the pain going down the buttocks, down the leg, pain in the calf muscle, to the big toe being numb. I definitely knew that this is not good. Something is wrong. But if you, out of anybody, you know, if you did have to have the back surgery, I already knew that I work for the best spine surgeon, and we're in good hands. But it was very emotional for me when I found out that he did need to have surgery. But I did also have a huge sense of relief and comfort knowing that there's nobody that I would rather have to do the surgery other than Dr. Baig.
Meeting him, you know, and the confidence that my wife had with him and the stories that my wife would tell me, you know, I had no doubt he would be the surgeon for me, and I had all confidence in him 100%.
Working here, you know, I know there's a lot more different kind of spine centers throughout the valley. I could even go to a different state. I could have even not told them anything, you know, and just kind of dealt with it on my own. But again, working here for the past 4 years and seeing testimonials, you know, these patients come in before surgery to after surgery. I mean, hands down, Dr. Baig is the best spine surgeon, and there is nobody that I would feel comfortable or that I trust. Not only just because I work for Dr. Baig, but because I'm a witness to seeing these patients and their recovery and the way that they, you know, their life is back.
There's no word for it, right? I mean, it's super grateful. Dr. Baig is an amazing surgeon, and I'm very blessed to have him as my surgeon, and had full confidence in him and his abilities, and just to know him and his staff is great.